First of all, greetings from Spain, from Madrid. My name is Ignacio Leal. I am vascular surgeon from the University Clinic of Navarra. Maybe we have met before, maybe not. So this is a great opportunity to connect. Thank you for watching this video, and I hope you find it interesting and you find we find together very nice discussion. Indeed, I presented this case really quickly during the last Paris Vascular Insight carotid session. It was an introductory case, so we didn't have much time to discuss in detail. So we really thought it was a good idea to share the case again with more detail and try to interact a little bit with you. And I will leave a few questions at the end. And I would love to hear your inputs, your comments, your ideas, and of course I will share with you all the questions, the answers, and how the case finally ended. So I think it's a great opportunity to share and to talk about real life, because we all know about the guidelines, we all read the guidelines, the trials, but then we have our real cases in our hospitals with difficulties, with challenge, with the need of interaction with other specialties sometimes. And again, I think this is a case that highlights the importance of this question. So the headline is, the title is Real Life Carotid Artery Stenosis. First of all, let me introduce you the case. These are actual real scans from the medical report from the patient, just to show you this is a real one. In the right on your right in the screen, you will find a brief summary of the highlights of the case. This is a 71-year-old male with hypertension, diabetes, dyslipidemia, like most of our patients have. A really rich cardiac history with a CABG, triple CABG in 2003. Current actual triple vessel coronary disease, a severe mitral stenosis, atrial fibrillation, and 3 recent admissions to the hospital because of a chronic heart failure. The patient had a carotid history consistent on a minor stroke in 2019 because of a right carotid artery occlusion, and 2 documented TIAs, left hemispheric, in the previous 2 months. This is the MRI. Let's see if the video works. I hope so. It's working. You will see here the right carotid occlusion. Remember, it's the ancient symptomatic one. A right vertebral occlusion too, which is interesting to the case. And then the left carotid artery stenosis, which is now symptomatic. Again, this is the summary of the case. And the cardiologist thought at that moment that the patient needed surgery, needed to fix the coronary disease, and needed to fix the valve disease. So of course, with this coronary complex environment, then the carotid history, they ask our department for our opinion. And here we are. First question is, should we plan a carotid intervention for this patient? Second question is, when? Before, during, or after cardiac surgery? And if we decide so, what kind of treatment we think is the best in terms of the risk, in terms of the benefits, and of course, taking into account the complex environment of the patient. Let me remind it to you, 71-year-old male, hypertension, diabetes mellitus, dyslipidemia, CABG, current triple vessel disease, severe mitral stenosis, AFib. Remember the carotid history, right carotid occlusion, right vertebral occlusion, left symptomatic carotid disease. I intentionally missed one of the highlights of the case, which is this one. The patient had previous cervical surgery plus irradiation. So this adds a little bit more complexity to a really complex case. This is the scenario we have. This is the patient we have on the table. These are all the cards on the table. And again, my 3 questions. Should we plan a carotid intervention for this patient? If so, when? And the third one, the last one, probably the most important one is, what kind of treatment are we offering the patient? Of course, best medical treatment is an option. And again, I am looking forward to your questions. I am looking forward to your answers, to great discussion, and feel free to write and to connect and to interact with us. Let's have a nice journey. Stay tuned, and I will talk to you soon. Thank you.